We are an active duty service, and we're a health and rehabilitation profession that works with soldiers and their dependents on orthopedic and neuromusculoskeletal rehabilitation to get them back in action. If their functional capability has been compromised in some way due to an injury or a pathology, we work with the active duty soldiers primarily on orthopedic rehabilitation of the upper extremity, because soldiers have to be able to do their push-ups to pass their PT tests. They have to be able to use their trigger finger to fire their weapons to stay safe and fight the enemy. And we also, they have to be able to do their litter carries or carry their heavy duffel bags.
Let's say you're a plumber, okay, and you have like a hand injury or a crushing injury in your hand, and you have issues doing your job and your simple tasks. We can place something like this in front of you. Now, as simple as this looks, this actually takes you through all the ranges of motion of the hand. You know, you can go through turning this way. You know, if I want to work on the wrist, you can, you know, go this way and turn this way. This works on your flexion and extension of the wrist, and this will take you through every single motion that you can do with your hand, and we can tighten it and we can make it looser. So this is actually a full upper extremity workout, and it's also work hardening. So it's two things with one stone. You're working through full range of motion, you're having fun and putting something together, and you're also doing some work hardening in which you're prepping to go back to work.
We also offer inpatient bedside rehabilitation to work with people on their ability to get dressed, transfer on and off toilets, be able to get in and out of bed as independently as they can, so that they can go home and lead a high quality, satisfying life. This is our activity of daily living bathroom, and so for some of our soldiers as well as our veterans that are having difficulties with walking or transferring from one service to another, we'll practice what we call functional transfers. So many times soldiers are going to go home to a bathtub transfer. So what we do is we train soldiers on how to transfer safely from this surface to that surface, because obviously this is a barrier. So we would teach them how to sit safely, and we would practice and teach them how to lift their legs with proper body mechanics so that they can prevent falls. Talk about the importance of having grab bars so that they learn how to adapt their homes so that we prevent further injury. So it's good to practice it while they're still in the hospital. Occupational therapy actually was created in the Army. During World War I, we were reconstructive aides. And that's where occupational therapy and physical therapy, the professions, were developed originally, to work with soldiers, the GIs, on their rehabilitation to become as independently as possible.
This particular machine works different muscle groups, anywhere from fine motor skills to gross motor skills. It can simulate bringing up a weapon to position. It can simulate for anything as simple as opening a bottle or opening a jar.
The kind of injuries we see here, we see all types of injuries. A lot of fooshes. Remember, this is an air assault base, so foosh is something called the fall on outstretched hand, in which someone falls, and as you fall, you naturally put your hands out to catch yourself. And what you tend to do is you'll get something called a DC or a VC fracture, which is like a small fracture at the base of your palm, which usually your lunate will rotate one way or the other. Now we have different splints to help you stabilize that. We also go through different machines and types of therapy to help you get better. But it's not just regaining the strength in your hand, but we want you to go back to doing the things that you enjoy, the things you used to do. So we try to make therapy as fun as possible, and at the same time, you know, subconsciously, we take away the pain because you're doing an activity. Now these activities you're working on your subconscious, you're not thinking about what you're doing and having pain, but you're enjoying what you're doing. So if you come down here, you'll see that we have different things you can work on. It's not just this, but we have the screwdrivers that you can practice unscrewing things. This one guy came in, he wanted to work on his car. So, you know, we simulated different aspects of it, and we had him work on that. So now when he goes back and he wants to work on his car, he'll have all the ranges of motion he needs in order to accomplish that task as well. Any injury we see, we have a splint for it, whether it's a CMCJ, which is just a joint issue, or a nerve issue, in which we'll see a lot of people with median nerve issues. We have something to treat all of those, but we deal with mostly upper extremity issues.